Thank you for being here again.
Thank you.
Everybody? Good. Okay. Good morning. I'm Terry Allen, the Health Commissioner here at the Cuyahoga County Board of Health. To begin today, I'd like to welcome our County Executive, Armin Budish, to the podium.
Good morning. Again, I want to start by thanking Commissioner Terry Allen and Dr. Heidi Gullett, who have now been officially recognized as the best in the world, and I certainly agree with that assessment. They are smart, they're compassionate, and we're in good hands with them and their leadership and guidance. Thank you both.
Thank you.
Yesterday, Governor DeWine, who has been a national leader in this fight against the coronavirus, announced that Dr. Amy Acton, director of the Ohio Department of Health, issued a stay-at-home order. She did this because we can slow this virus down, and we must do that. We must all take this very seriously. We are, all of us, in the midst of probably the greatest battle of our lives. We're fighting for the health and well-being of each and every one of us. Every action that we take will have an impact on another person. The director's order asks us to do three things. First, to stay in our homes, leaving only for essential services and needs. Second, to close all non-essential businesses. And third, to stop certain activities which add to our risks. And the only way to make sure this virus does not beat us is to continue to do exactly what we're being asked to do. Now, I recognize that this represents, for many of us, great sacrifices, maybe the greatest sacrifice that we've ever been asked to do. This is a war. It's a war against a virus. During war times, whether it's the Vietnam War, World War II, the Korean War, and during any of our wars, we come together. We make sacrifices together for the greater good. For too long, our country has been divided. Sometimes it seemed that families and friends were being torn apart by our differences. This virus is showing us in starkest ways possible that, in fact, we are alike. This virus doesn't recognize age, it doesn't recognize skin color, income, political organizations. It affects us all. The governor, Dr. Acton, and we here in Cuyahoga County have been making decisions that require balancing critical issues. I support the governor's decisions, which shut down many businesses and institutions in order to limit the spread of this deadly virus. This decision was necessary to save lives. But we recognize that it also creates great hardships. Hardships for people who are put out of work, hardships for people with small businesses, businesses that they built up and fight every day to sustain. I know it's not easy to run a small business. In my past life, I actually ran 2 small businesses. I know it's not easy to stay successful even in good times. And I know it's devastating if you're forced to shut down. I understand and I feel the pain of our small business owners. If you're out of work and worried about how you can feed your family, how you're going to keep the lights on, how you're going to maintain your mortgage and keep the house as yours, there's some help available. First, go to Ohio Means Jobs, ohiomeansjobs.com, and open an account there. At this site, you can find out about job opportunities. There are several large businesses in Cuyahoga County looking to hire hundreds and hundreds of employees right here. Their services are free. They also offer online programs, career advancement programs for people to utilize. Second, you may be eligible for unemployment insurance. Apply at unemployment.ohio.gov. If you worked at least 20 weeks with an average salary of $269 a week or more, you should be eligible. I'm working to ask the state to change, to loosen some of the requirements during this crisis so more people can qualify. Third, you may qualify for our standard county benefits: Medicaid for health care, SNAP for food, and TANF for cash assistance. You can apply at benefits.ohio.gov. Some of these programs are not the easiest to handle by yourself. If you have questions, call United Way at 211. They run the 211 system. I'll be increasing the county's financial support for 211 so that they can hire more staff to answer your questions. Small business owners are creative and resilient. Many will change their operations to survive. For example, Edwin's, which is a fine dining restaurant in Shaker Square, a sit-down restaurant, has shifted to takeout. I went by for my dinner Friday night, and I can tell you that there was a line of cars around the corner. They are successfully coping with this crisis, and I applaud Brandon Krastowski for his ingenuity. For small business owners generally, there's help available. The Small Business Administration can make low-interest loans up to $2 million to small businesses. You can apply through the SBA disaster website at Economic Injury Loans. The county, while I've been in office, has partnered with groups like the Economic Community Development Institute, the Urban League, and Jumpstart to financially support small businesses. And we're working with them, our partners across the board, right now to provide additional help to small businesses. I've created a small business task force to figure out other ways to help small businesses in this time of crisis. We're talking to partners about creating a business stabilization fund to assist small businesses, and we're working with our local banks as well. Small businesses are the backbone of economic growth in the region. It's heartbreaking, it's truly heartbreaking to see these businesses with doors shut and lights out. We cannot let them die. This is a very tough time for people facing unemployment and for small businesses dealing with closures. The governor's orders and our local actions are designed to protect people's safety and save lives. But I know for many of us, there will be hardships. This will be very hard. As Dr. Acton said, life is not shutting us down. Life is waking us up. We can do this. We will get through this together. We're tough and we're resilient here in Cuyahoga County. By coming together, we will survive and we will thrive. Thank you.
Thank you, Executive Beauties, for your comments and for your leadership and your support, and particularly in the Emergency Operations Center. We continue to work hand in hand in the joint City-County Emergency Operations Center to assure that messaging across the community is uniform and that information issues that arise are centralized, addressed, and then disseminated to agencies that can assist to address citizens' needs. It's a great resource in times of need. So I'll start off by saying that we're following the Ohio Playbook. The Ohio Playbook is designed by Governor DeWine and Dr. Acton, and it is informed by internationally respected infectious disease epidemiologists who are following the science, following the data to determine our path forward. And so we should be aware that this is based on sound science. It's been incremental as we go forward, identifying ways to try to limit spread. And so we understand that spread limitations that we place on folks can affect people's sense of freedom, and that can cause some anxiety. But what we want people to recognize is that the silence, the stillness that they're experiencing in their communities with the order pending and certainly as we've seen a range of issues around closures and restrictions, that stillness is the sound of prevention. It is the sound of reduced number of interactions that will help to reduce spread to our seniors, to our at-risk individuals. It'll help protect our EMS workers. It'll help to protect our healthcare workers. And that sound of prevention is that stillness. And so recognize that even as you adjust to this new way of life in this moment. We will get through this. We've heard Dr. Acton and the governor say that. Greater Cleveland will get through this. So we ask for your support. Be part of the solution. Be part of the prevention solution. So we know the governor's stay-at-home order allows for residents to leave for a range of reasons, and I would refer you to that around health and safety needs, necessary supplies and services like medications or going to the grocery store, or patronizing your local restaurants for carry-out or pickup. Outdoor activities, run or walk with your dog. 6 feet distance is good. Physical activity is good. Get out and 30 minutes a day, by the way, of physical activity can reduce your risk for chronic disease as much as 40%. So always good to get out and walk for at least 30 minutes. Take care of your family, friends, your neighbors, particularly your seniors, and don't forget about your pets. So it's important to know that public health is included in this critical infrastructure network. We're all part of the, as Executive Buter said, we are in a war with this virus. The governor has talked about this national effort in response. So we're combating this virus, and we have a bunch of public health warriors that are among you in the back of the room. These are physicians, medical students, epidemiologists, lawyers, environmental health sanitarians, a range of data analysts, support staff that have all been working to address these issues. So it's important, I think, for people to recognize that we have committed 24/7 work through the weekend to address this pandemic, and we will continue to do that, to do whatever it takes to respond. So businesses that are staying open through this governor's order, we go back to the hand washing guidance, particularly our restaurants. Our environmental health sanitarians are in restaurants throughout the community, and they are doing their standard inspections, looking at temperature control, cross-contamination, wearing gloves while you're handling food. These sort of things that we're doing to try and reduce risk continue. Social distancing in grocery store lines, inside of drugstores. Go for that 6-foot distance. We think that's very critical. We want to offer special hours for at-risk populations. We're seeing grocery stores open up early for seniors. I'm seeing signs in grocery stores that talk about social distancing when folks walk into the room. So these are all important steps that we need to continue to take. Remote access in businesses. Remote access is critical as well. So we know that, and we appreciate the grocery store owners adjusting and also becoming a part of that prevention message by incorporating social distancing messages into the daily work. And so we want that when you're out, observe that, be conscious of the prevention message at post offices and as I say, in pharmacies and grocery stores. Make an extra effort to encourage others to do so. There's been an outpouring of generosity that happens in Greater Cleveland in these emergencies. So we want to thank everybody, businesses, individuals that have contacted us for support and also have said we want to be part of this response effort. We've connected them with the Emergency Operations Center to assist residents on a variety of needs. We've seen incredible support from the Red Cross, where they may need to be able to offer food to folks that need to stay home during quarantine. Incredible efforts around helping people get their medication, and also, as Executive Buter said recently, helping designing efforts around supporting the homeless population, people who are often ignored or invisible. It's admirable, and we want to thank all of them as they are very much active in the desire to assist the community. So partners have been busy through this. These are the Emergency Operations Center partners, hospital, EMS, the Center for Health Affairs, working with the emergency operations centers. There's been a fantastic outpouring of support. The people in the Emergency Operations Center have been working feverishly to address concerns, and the foundation community has put together support to meet these social needs that are emerging, and we think that's fantastic. The United Way, of course, has the helpline, the Cuyahoga County Coronavirus Helpline, and we encourage people to use those resources as well. We know that and you're going to hear a bit from Dr. Gullett about the value of what we established now 7 years ago, Connections Back, with Dr. Gullett, who became our population health liaison. And I'd like to thank publicly Dr. Kurt Stenge, who helped to organize that way back when. His incredible foresight has helped to pave the way for the work that we're seeing today and the connections that exist today. So these folks are doing what they're trained to do, working in hand with our existing epidemiology response staff and disease investigators and a range of support networks. And the relationship has been fantastic. Remember, again, this has been going on here in terms of emergency response since post 9/11. Legionella outbreaks, H1N1 influenza, Ebola, the anthrax response, the smallpox response. We have years and years of service and experience in this community that's incredibly valuable to all of us. And we want you all to recognize that this is about saving lives. This is about saving lives to people that matter to all of us, the people that matter to all of us. So abide by this order. Abide by this order. Only critical infrastructure people should be moving about in the community. And remember that food and medicine, people can seek out if they need it. Check on your neighbors. We'll go back to these non-pharmaceutical interventions, and what you're seeing is a tiered approach based on science that we've seen around restricting crowds, around religious ceremonies being through the congregations being restricted, to stop that interaction. And now we join several other states with this governor's order to further restrict movement for a time, to try and reduce the risk for transmission. So we know that good hygiene, social distancing are certainly at the forefront of what we're messaging that everyone can do. So we'll go back to our messages that we share time in and time out around covering your coughs and sneezes, coughing in your elbow with a tissue. Throw it away in the trash can. Emptying those trash cans, be sure you're wearing gloves if you're in maintenance staff. And commonly such surfaces need to be washed frequently. Don't share your food, drinks, knives, forks, or spoons with anyone. And if you're sick, please stay home. Please stay home if you're sick. I can't emphasize that enough. We don't want to unknowingly and unintentionally light a fuse for transmission in this community and start a new chain of transmission. So that is very critical. Employers need to allow people to stay home. At this point, I'm going to transition to Dr. Gullett, but I want to say something first. I've been here for 30 years in public health. And there have been questions over that 30 years from lots of people about a range of infectious diseases that are people's personal health information. Personal health information. And we protect people's personal health information by reporting information at the largest aggregate level, county level, and we'll continue to do that, as we would all want our own personal health information to be protected. So that's a commitment that we've maintained for 30 years, and we intend to maintain that commitment going forward as we respond to this, continue to respond to this pandemic. With that, I'm very happy to welcome our medical director, our friend, and our comrade in this response to this war against this virus, our chief medical public health warrior, Dr. Gullett.
Good morning. I would like to begin by offering my sincerest condolences on behalf of myself and our team to the family here in Cuyahoga County who lost a loved one on Friday evening from this virus. I'd also like to extend our condolences as well to the other two families across the state of Ohio who also lost loved ones related to this infection. Any loss of life related to this infection or any other reason is devastating. And our team has had a moment Saturday morning that really we carried through with us all weekend, recognizing that this is very, very serious. We've known it's serious, but when loss of life begins to happen, it moves to a new level. So we want you to know we're fighting to minimize any future loss of life, but we recognize that this is a formidable opponent, and we're really doing our best, but we need your help. And we will have more loss of life if you don't heed our warnings and you don't listen to what Dr. Acton is saying and what we're saying. Please, please do what we're asking, staying home and social distancing if you need to be out, because we don't want to continue to report on any future loss of life in our community or in our state. I also want to remind you, before I give you today's updated numbers, that every single person touched by the cases of infection I'm about to report are important members of our community. And so again, we want you to honor their privacy, but also recognize the extra support that so many members of our community need right now, whether they themselves are fighting this infection or they are fighting on behalf of one of their family members who has the infection. The case count this morning for Cuyahoga County, exclusive of the city of Cleveland, is 99 lab-confirmed cases. The age range for those cases is 14 to 91. The median age of the cases is 49. The date of illness onset is February 29th to March 19th. And we have had one death in Cuyahoga County to date. The hospitalization numbers are becoming increasingly challenging for me to report to you. My goal today is that we identify a better way to give you updated numbers on hospitalizations. We've all heard about surge capacity, and what that means is the ability of our hospitals collectively to handle the number of infections and complications from the infections that we're seeing. On many of those curves you've seen Dr. Acton and others show, there's a level of what we say hospitals' capacity is to handle this infection. And our goal is that we try to flatten the curve so that our hospitals don't surge above the capacity they have to care for the patients that are the sickest. But it's changing constantly, and so it's hard for us to report that on a regular basis. We will do our best on our briefings, our regular briefings, to give you that information, but as of this morning, I didn't feel comfortable sharing the numbers because I feel that they're probably inadequate. What I can report is that we have had 7 ICU admissions reported in the Ohio Disease Reporting System for our combined jurisdictions, but that is likely behind because we're having to enter things very quickly as the number of cases rapidly increase. I want to speak for a moment about testing. You heard Dr. Acton again talk about testing this weekend, and I want to reiterate her message. Testing needs to be reserved at this time for those who are most ill, our hospitalized patients, those sickest in our emergency departments. Testing is not available at this time for the general public, nor is it available for those with mild infection. We are trying to do our best in messaging so that people understand that if you have a mild infection, we need you to isolate at home. And that means we need you to stay at home and try to stay away from your family and friends who don't have symptoms as much as possible. But testing is not what we have available to do right now, so we treat you as if you have that infection. And our team of doctors and medical students is trying to give those messages on the phone over and over again, but in this briefing I'd like to also give that message to the group. It's really important that we consider this approach very systematically. You heard Dr. Acton on Saturday talk a little bit about our approach here, and that's the same approach we're all trying to take across the community and the state, and probably across the nation. I'm going to briefly talk about a few arms of our approach here, as I know that some people would like some additional clarification about what we're doing. First and foremost, we're trying to flatten the curve by identifying cases, so lab confirmation that people have been diagnosed with COVID-19, and then making contact with those people and identifying any contacts they may have had while they had symptoms. That's called contact tracing. It's important to do that because then we follow the disease investigation. This is really about good history taking and being a disease investigator and identifying those most at risk for the infection. So some people have questioned, including even some of my family and friends, saying, wow, this is so big. How are you continuing to do all of this identification and contact tracing? And I say to them, we need to continue to do that. That's one of our core critical strategies to flattening this curve, and we're not going to stop doing that. And we have a group of folks here that are working tirelessly on that. We worked all weekend on that as more cases came in. The other thing is we're staying very closely connected to our healthcare partners, and that is through multiple channels. But our goal is to identify any places where there are higher risks for transmission. So those would be places where people would be congregated close together. And thanks to the leadership of our governor and Dr. Acton, those places are minimal now. We don't have large gatherings. We acted very quickly following the lead of both Governor DeWine and Dr. Acton to minimize those risks for transmission in large groups in our state. But we still have essential places of business where we cannot minimize or close. Hospitals, healthcare organizations, places like that. So we work closely with those partners to identify any potential high-risk situations where there may be an employee or a patient who is identified. And that's why this whole discussion of personal protective equipment is so important, because in our healthcare facilities, if we identify a patient or an employee who becomes sick while at work, we immediately need to isolate them, get equipment on them, and get them to a place where they can't give it to anyone else or no one else can contract it. So that's one of our other key pieces, those high-yield places. We also, through our disease investigation, identify places in the community where we see what we call clusters of infections. Those are infections that we might see a couple people who happen to have been in close contact with one another identified. So we actually are deploying a little extra resources in those places, and that has really helped us, I think, minimize transmission for other people who might be that next layer out of contact to those small clusters. Next, we're working on supporting individuals and families that may have specific resource needs. This is not going to end soon, and so we need to be sure that people have the resources they need to safely isolate when we identify that they need to do that. Now we're all staying at home, but we also know that some people may be sick at home, and so our job as a health department is to ensure that people have the essential necessary services that they need. And so on the phone, we're identifying that. When we have cases, we're asking, what does your floor plan look like? Are you able to safely isolate away from others in your home? How many people are in your home? Do you have food? Do you have basic needs met? And when we identify that those things are needed, we have a resource unit leader here who is in the back of the room right now, who all weekend I sent him things, and he's working with our Emergency Operations Center to ensure that those needs are met. So we're doing all of that to say that there's a human side of this, there's a humanistic piece of this, and we cannot lose sight of this. We're in a war, but we also have to know that people need to eat and do the basic things they need, their medicines. So we want you to stay home, but we're going to help you with that. And we have an army of people in the community ready to serve that. And our final strategy, before I move on to that, one more thing. I want to highlight that we're trying to do this in the most linguistically and culturally appropriate way as well. So if you're somebody out there who's listening to this through a translation, or somebody who doesn't speak English as a first language, or somebody who needs some food but you need some ingredients that are appropriate to the way you know how to cook, we understand that, and we want to know that, and we want to help you with that. And we have language services available. We've been working hard. Our team here has been translating our written materials that we're sending out about isolation into multiple languages. So if there are needs or languages that we have not yet identified, please call our line and let us know, because we want every person in our community, in whatever language is their first language, to be able to understand this information as well. Finally, our last approach is about looking at community-level data. We don't have widespread testing. You've heard me talk about this at every press conference for the last week. But what we do know is we can use the data we have to create a curve. You heard us talk about flatten the curve over and over. But we need to know what our local curve looks like, and we can only do that when we have data. So we're working hard to use the testing data we do have available in our community to understand what our local Cuyahoga County curve looks like, so that we can do our best to flatten it in the ways that are most appropriate to this community. So we'll continue to do that on a regular basis, and we're working with our regional partners on that as well. Last night, Terry, myself, and others spent some time on the phone with Dr. Acton, other Ohio Department of Health colleagues, as well as our other local health department colleagues across the state, sharing what we're doing in real time just-in-time learning so that we're not reinventing the wheel, but we're helping one another and we're maximizing efficiencies across jurisdictions. We are all in this together as a community, but as local public health partners. And so we're trying to standardize the way that we're approaching this the best we can. And we know that a lot of our people, especially those in essential services and healthcare, may live in other jurisdictions but work here in Cuyahoga County. So we're working to make sure that everyone is cared for across lines. We also want to be sure that the best available data is available to all of us around modeling. So Dr. Acton has really worked hard, and the governor, to bring in the best experts to help us understand in this 7th populous state in the country about how we can, as Ohioans, really get ahead of this. So I just want folks to know that we're working alongside, arm in arm, with our local health department colleagues next to us and around the state, but also with the state. I wanted to also publicly thank the Case Western Reserve University School of Medicine Dean, Dr. Davis, who 7 years ago made it possible as a strategic priority for the medical school to improve the health of the community, to allow me to spend time here at the Cuyahoga County Board of Health. And one of the things that's come out of this really difficult time that we're all in is the recognition that partnerships, long-standing, trust-grounded partnerships, make all the difference when we reach a crisis. And so what you're seeing here is not something that we threw together in a week. This is something that we've spent almost a decade building trust between partners. And that's also what you see as I talk about our partnerships with our hospital. The Center for Health Affairs, our regional hospital association, is also critically important in this, bringing our hospitals together. And they do that day in and day out, even before the time of crisis. So I wanted to highlight just a few partners, and I'll continue to do that as we unfold. I wish I had hours to name every partner who stepped up to the plate in this crisis. But I want folks to know that when this is over, we can't walk away from partnerships. We have to create more of them. We are all related to one another, and interdependence is the key to us being a strong community on the backside of this crisis. Finally, I would like to thank our media partners who are here today. You too are essential helpers in all of this. You are a critical partner to getting our trusted message out. But you too are at risk. You're here, right? We're appropriately socially distanced in this room. Those of you watching on the internet or on TV can't see what this room looks like, but we reoriented the room. One, because it was important to show off our 100 years of public health wall, but two, it was most important that we were able to socially distance our media partners in the room. But I want to recognize the toll that all of you may be thinking about on your own personal lives and also on the lives of your families. So I want to publicly thank you for your partnership in this, and we look forward to continuing to work with you as long as it takes to get through this. Finally, you've heard me talk a lot about self-care and gratitude, and I'm going to keep talking about it because in a war, you can become weary and you can become worn down. And we can't afford to do that in our community, in our state, in our nation, or quite frankly, in the world. So we had a moment on Friday, our self-care gratitude moment in the morning for our team, and we invoked Mr. Rogers, and I am of that age where I grew up with Mr. Rogers. And he talks a lot about helpers. I think actually it was his mom, and he invokes his mom's memory, and now we invoke his memory. And he says, where there are helpers, there is hope. And I want to leave you with my remarks today on that note, that this room here, this building, even though most of our staff are working remotely, we are all helpers, every single one of us. And because we have helpers rising to the occasion who will never be known publicly, we will never know the deeds that they've done, the donations that they've made, the simple ways that they've extended kindness to others. But they're all helpers, and because of that, we have a lot of hope in this situation. So that's one of the silver linings we can take away from this. So with that, I'll step away and we will take some questions. Please bear with us as we appropriately socially distance between transitions when you're asking us questions for another person.
Excuse me. Okay, excuse me. I do have a couple closing comments, and then we will, of course, go forward with questions. Heidi talked about gratitude, and I want to echo that. My appreciation in particular for Dr. Akram Boutros, the CEO of Metro Health. He is a true community-first CEO, and his support of our work to try and reach out and identify areas of concern, Metro being there at every turn as our county safety net hospital has been remarkable, and I wanted to publicly thank him. I would also say that what Dr. Gullett illuminated is that medicine and public health were separated at birth. And what we're seeing now is the need for this reunification. It's happening in real time. This connection between public health connected to the community, what happens outside the walls of the hospital system, being sort of seamlessly interconnected with what happens in the system, that we're all part of the overall system of care for Greater Cleveland and for the people that matter to all of us the most. So we are at a crossroads. We're at a crossroads. And I want to specifically talk now to young folks like my kids who are home from college, a couple of them, and other young folks that feel they are invincible. I remember being that way myself when I was much younger. I think we all do. But we are not invincible. We are not invincible. And it isn't just about us individually, right? It's not about us individually as kids, as teens, or folks in our 20s. It's about our grandparents. It's about our senior neighbors that we care about and we love. We need to protect them and not unknowingly become part of the chain of transmission by spending a lot of time congregating together in places because we think this won't affect us. The data shows that we can unknowingly, young folks, be part of that chain of transmission and adversely impact those seniors that we care about most, those fragile folks we care about most. So please take the moment now to be part of the solution. Take to heart this governor's order. Take to heart the governor's order because he's following a science playbook that is designed to increasingly reduce risk of transmission. And we're on board. The public health community is on board. Be part of Greater Cleveland's answer to this pandemic and get on board with the response. So with that, I'd like to stop and ask that all of us here be available for questions for you. What questions do you have?
I'm wondering, you folks have said that there are 99 lab-confirmed tests in Cuyahoga County, excluding Cleveland. How many negative tests have there been?
So I'll let Dr. Gullett expound. That's a hard number to know for us right now. I think what we're trying to do is everyone's so busy in the response mode, getting a handle on what the negative test numbers are is a bit of a challenge. We know there's still, by the way, a lot of flu out there, a lot of influenza A in particular in the community. So that is out there circulating even as we're working to address the COVID-19 response. So while we would like to know what the negativity rate is right now, the data is pouring in fast, and many of our healthcare partners are busy in response mode caring for people clinically that need assistance. So I don't think we have a good number on that right now, but Dr. Gullett can, I'm sure, offer some additional thoughts about that.
So you heard me talk about the we call it the epi curve, the flatten the curve approach. You have to actually have a curve to be able to understand if you're flattening it. Part of that also is what there's another number that we like to follow that's called a percent positive, which means that we want to know how many tests are positive compared to how many tests have been done. And a couple days ago, earlier last week, the Ohio Department of Health had notified all of us that labs were no longer going to be putting in their negative results to our Ohio disease reporting system because every single one of the positive results and negative results had been sort of entered in from the lab. And then that's separate from providers who order, who also have to notify us as a health department. So there's a huge efficiency around reporting lab report as well as reporting positive to health departments. And because thousands of tests had been done in the state of Ohio, and most of them had been done here in Northeast Ohio, it was impossible for them to put in the negative results. So we have been working actually closely with the hospital partners who are running in-house here in Cleveland, which is Metro Health Hospital, Cleveland Clinic, and University Hospital, to understand exactly how many tests they've run. And then that gives us that, what we call the denominator, that bottom number, to be able to actually calculate how many are positive that have been totally done. But there's not a good systematic way right now to do that, and it's partly because of the number of positives that need to be entered and the amount of information. So we're doing our best. We've actually been on the phone on and off all weekend with the lab directors, and we all want that number. The other thing to know, and I mentioned this last week, but I'll reiterate it, is that When there was a lot of drive-through testing happening for a few days last week, those swabs weren't all run for COVID-19. They were run for influenza first, and RSV, which is respiratory syncytial virus, another commonly circulating virus right now. And if those were positive, any of those were positive, then they stopped, and then that person was diagnosed with influenza or whatever, or RSV, and then the COVID was not run. But if the tests were all negative, then COVID was run. So we can't just stand up and say there were this many thousands of tests run, therefore that's how many COVID tests were run, because they weren't. It's a little bit more complicated than that. So I want the public to know we're trying to get that information, but it's going to take us probably the rest of this week to flesh out and give you accurate numbers. But that is something we're tracking.
Usually you guys reorganizing this for everyone's safety, really. Are you able to social distance with your amazing sign language interpreter as well? Just because, you know, based on the camera, it really doesn't look like 6 feet.
Right. So as you saw, the Ohio Department of Health and the governor have socially distanced with their sign language interpreter remotely. And so we are doing our best. The county has provided the resources for her services. We had to make a tough call about having her here or not, because we didn't have that available for us, but that's an important suggestion, and we are doing every day. We find new ways to socially distance, so we appreciate your suggestion. Her safety is of the utmost importance to us, and today we wanted to ensure that all of our hearing impaired community members were able to hear this message, but we will do our very best to virtually bring her in the future. Or it's a little hard because everyone has one camera, so we'll work on that.
What is the status of testing supplies and PPE in the healthcare facilities across the area?
The question is, what is the status of testing supplies and PPE equipment, so personal protective equipment? First, let me explain what personal protective equipment is for those who may not know. That is equipment that protects anybody who may be exposed to someone who has the infection. And in this case, if someone has an infection, anyone coming into contact with them, for example, in a healthcare field, would need full personal protective equipment, which includes goggles so that there's no eye exposure, as well as a mask, a gown, and gloves. As you've heard, internationally, nationally, at the state level and locally, there are limitations in the amount of PPE that we have available. And these are all equipment that, you know, for example, masks, those particular N95 masks, they expire. So it's not that we can have a stockpile of millions of masks available, because once they're expired, we can't use them. You may have seen in the news some healthcare providers were using some expired masks, and they were breaking, and then therefore they're unprotected completely. So one of our challenges is that in a surge capacity situation like this, we have some stockpiles nationally, the Strategic National Stockpile, which our state is to get a shipment at some point, which has some PPE in it, but that still doesn't account for the fact that we're going to use that up at some point. And as surge capacity goes up, that line of what our hospitals can handle, PPE is a problem. So we're working closely with the Center for Health Affairs, and Beth Gatlin is the person who's been a long time, very trusted partner for us around bringing the hospital information together in one place. So she's working tirelessly day and night to figure out what those PPE resources are and what the testing capacity is. I spoke with the state health department partners yesterday asking if there was any additional information around testing. We still don't have any information about widespread testing availability. So we're working with what we know, which is our hospitals are ramping up as much internal testing as they can, but and we're using our commercial lab partners, LabCorp and Quest, when we can, but we don't have widespread testing capacity. I cannot give you numbers of the number of tests available, but we're continually dialoguing on regular conference calls about how much we have and what the PPE needs are. So as the Strategic National Stockpile information becomes more available and our hospitals continue to report how many cases they have and how much equipment they have, we'll do our best to keep you updated on that, but it's rapidly changing. And the bottom line is we don't have enough of either, but we're doing our best to make sure our frontline providers, EMS and healthcare and law enforcement, have all the protection that they need so we don't create new lines of transmission, for example, that they then bring back to their homes.
Have there been critical concerns about those levels at this time?
The question is, are there critical concerns about this level? I think we're all very concerned about our PPE. and our testing capacity, but I feel that our hospital partners are being creative. I will tell you, all weekends, I got, and continue to send these to our research unit leaders, I got people calling in and emailing in and saying, we found we have these masks. Where do we take them? We found that we might be able to sew masks, and we want to make sure they're compliant and they actually protect our people. So the Emergency Operations Center and our research unit leader are working on those creative solutions, but we are trying to coordinate so that the hospitals equitably get distributions for the surge that they have, and that we ensure that anything we did put out to our healthcare providers safely protects them. So we are concerned, but we are not panicking, and we are making sure that everyone is protected. And our hospitals continue to create just-in-time policies around how much they can use, how much can someone use a mask, how long can someone be on it. My husband's an emergency physician in town, and he was just updating me on what their guidance is about their personal protective equipment and things like that. We're also actively pursuing ways to sterilize equipment. There is a lot in the media about that, and our hospital partners, including some of our hospital CEOs, actually have been really contacting us regularly to talk about what we could do across the community with that. But we're not going to do anything that isn't safe. So we're trying to vet those options as well.
Deb, thank you. Dr. Gullett offered a personal note, and I want to offer this. I come from a long line of firemen and first responders, and my brother is an EMT. And so I wanted to thank Dr. Tom Collins at Metro Health. We've convened the EMS folks across the community throughout this process, and we'll do so as we proceed. They're among those on the front lines. So we reinforce issues around use of personal protective equipment. When you put it on, it's called donning your equipment. When you take it off, it's called doffing your equipment. So the procedures and the steps that you use when you are donning your personal protective equipment and when you are doffing or taking off your personal protective equipment are critical. So I speak to my friends in the emergency response community. Be sure to be careful. You know this, you teach this, but I reinforce that message. We want you to be protected. We need you, and follow those procedures around donning and doffing, using disinfection through the process to make sure that you're safe, just as we want our hospital partners to be safe, just as we want our preventive medicine residents to be safe when they're in the community.
Executive, one of the questions, or one of the points you made was we're pushing for changes in the unemployment rules. What are some of those, and does that
Include the 20-week mandate.
that may or may not be a safety net for a lot of restaurant bar workers?
Yes, we're looking at all the different aspects of the unemployment. We want to have people who are not employed have a safety net right now. The unemployment insurance has been expanded. We need it expanded more. We're looking at the 20 weeks. We're looking at the amount of income. We're looking at the types of work that people do that may not be covered. And we're having very good conversations with folks at the state. I also wanted to add, the question was, are you concerned about a lack of PPE? Let me tell you, we have a lot of first responders, too, with the county. We have people working in the jails that are in close quarters with prisoners. We have children, Department of Children and Family Services, caseworkers and investigators that actually have to go out to people's homes, go into people's homes, and check to see if allegations about child abuse or neglect are true. I'm concerned. I would like to have PPE, gloves, masks for all those people. Unfortunately, they're looked at as being lower down the chain than the nurses and doctors. I understand that, but we could use. We've gotten
Requests from cities, from our own departments, for thousands and thousands more masks and gloves and other PPE, and it's not there. So I am concerned about it. I want to keep our people safe that are doing the work for this community.
Is there hope of getting those thousands and thousands in the near future?
We have been out there trying to get them. We've contacted vendors all over the country. We thought we had one on Friday. It turned out it didn't work. I've authorized as much money as necessary to get those PPE for us, and we will distribute it if we
get it. as needed, both to our own folks, to the hospitals, to the cities that are asking for it, but right now we can't get it.
So, following up on that, I'm curious, are you having to compete with other communities? Are you having to bid up and spend more money? Why weren't you able to get them on Friday?
I'll answer that. Because they weren't there. I would say yes, we're competing. It's international. It's not just local. It's not just national. We were prepared to make an offer, to send a check in, and we had been told initially that they had PPE, and unfortunately, it wasn't there. It was used elsewhere.
So to sort of expound on this a little bit, there are several paths that we know are underway to try and address this problem. Certainly nationally, there's been some coverage that 3M is beginning to produce a lot of masks in other industries. Some are now pivoting to produce surgical masks. So we're talking about both those N95 respirators and surgical masks. So we're seeing industries pivot to try to create more supply. We also know that, as Dr. Galt mentioned, Beth Gatlin from the Center for Health Affairs is coordinating donations that may come from the community for masks and other personal protective equipment. So that is a way to think about what you have, what you may have available that you're not using. How can that be funneled to people that need it? Also, we know that first responders and other people in the medical response community are looking at how they use PPE, personal protective equipment, and when they change it to try to get the most life out of that equipment with the most safety. So that is, they're new procedures, and they may make alterations in order to get the most life out of those protective pieces of protective equipment, even as we look forward to start seeing more supply expand. This is a national problem. This isn't just an issue locally. So we're hopeful that we'll start to see the flow come in, but right now we're going to do the best we can to work with facilities to assure that people have what they need to protect their workers, but it is a challenging moment.
And I might also add along those same lines that I've had the opportunity to speak to the CEOs of all the hospitals as recently as yesterday. We've talked about a lot of different options, as
Terry mentioned, one of which I think Terry mentioned in his remarks, or Dr. Gullett, it was sterilization. So we're looking at whether
we can take existing masks, for example, and sterilize them, not destroy the masks' effectiveness, and reuse them. That's something that some entrepreneurs, innovators are saying that that's possible. We're looking at that. We're exploring it. I don't know whether it'll work or not.
Just to finish up this last line of questioning, if you are out there and you are a nonprofit, which we have had multiple nonprofits actually call in and say we have supplies from all sorts of things,
From wipes to
nasopharyngeal swabs to personal protective equipment, or you know somebody who has them, if you have a donation,
we will ensure that it's equitably distributed. So please call our COVID-19 line if you have something to donate, and we will ensure that we put it with the rest of the distributions that we are getting in. That phone number is 1-855-711-3035.
Again, if you have a donation that you would like to contribute,
or you think might be of use, call us at 1-855-711-3035. This has been a remarkable time of people being innovative, but also people finding they have a box of N95s here and there that they didn't realize they had actually all weekend. So please look around if you are in a facility that might have those and let us know.
We'll take one more question.
You talked about the EpiCurve locally. Is that something that you've been able to map already, or are you still gathering data? And if so, how does that compare to the state curve so far?
So the question is, our local EpiCurve, is that something that we've been able to take the EpiCurve and map, and then how does that compare to the state? And I would guess others want to know the nation and other countries. So our EpiCurve is something that we are actually using what we call GIS or mapping, and we are looking at mapping a couple different parameters or variables. That includes understanding where lab confirmed cases are, as well as understanding where what we call presumptive cases are. So we have somebody who is sick but not sick enough to be in the hospital, but we presume they have the infection based on their symptoms and they're isolated at home. So we're looking at a couple different ways to do that, but those, and so that helps us as disease investigators. That's information for disease investigation. We are very careful about how we share those data because those are protected health information. We would never want to identify a location of anyone. You see us give very aggregate data. We're not going to tell you anything below the lowest aggregate that we can safely release. And so we are using every public health tool we have. We have a remarkable public health community here in Cleveland with resources that we're so grateful to have around the ability to do data analytics and mapping. So we are using mapping, we are using our EpiCurve. As it compares to the state, quite honestly, we have the most cases in the state. So as you see the state cases rise, there may be a little divergence in what the state EpiCurve looks like, but thus far, we've pretty much had most of the cases. I think now we still have the most, but there are several hundred others reported as of the website last night. So right now, there's not a lot of divergence, but we'll continue to watch that. We're reporting to our state partners what our EpiCurve looks like for both our lab confirmed and presumptive cases on a most frequent as we can. We're hoping daily, but sometimes it's every few days. The other thing is we're also tracking what the symptoms look like about this because this is a new virus and none of our immune systems have seen it, which is why it can be so clinically devastating. Sometimes our immune systems are warriors and we mount a response and we get a mild infection because we're able to fight it off quickly. But because none of us has immunity to this, there's no vaccine and none of us got it when we were kids and carried it on. None of us get antibodies through breast milk from breastfeeding moms, right? In a year or two from now, that will be the case, but it's not right now. So because of that, we're looking at all the symptoms that are being reported to us by the cases. So we're also tracking that as sort of a population level thing, and we're looking at % of people who have cough and shortness of breath and other symptoms that maybe aren't reported traditionally related to this, but we want to understand this virus and how our immune systems respond to it as much as possible. So as that unfolds, we'll also continue, once we feel we have solid data, continue to give you that information.
Okay, well, thank you all very much. Take care.